Periodontal disease, by our current understanding, is what we call a chronic immunoinflammatory disease. Let's break that apart. Splinter in the skin analogy. If you get a splinter in the skin and you're a busy person, you may not even know it's there. It's a chronic issue. The hallmark of chronic disease is frequently they are painless or of such a low-grade intensity. If you're a busy person, you dismiss it and you get on with life. An extreme example of chronic diseases are things like cancer and diabetes. A lot of people have walked around with cancer or diabetes not knowing they have it until they have that event or that diagnosis. All right, moving on to the inflammatory component. If you leave the splinter in the skin long enough, frequently, but not always, the skin around that splinter will get red, hot, puffy, inflamed, and sore to touch. Inflammation is the body's generic response to deal with crap it does not know what else to deal with. So in this instance, it's breaking down the cells. The splinter comes out, there's a bit of blood, there's a bit of discharge, but generally you're okay. Now, this is where the mouth is unique. The mouth is the only part of the body where a hard, non-shedding surface with either teeth or implants is exposed to the outside world. So when plaque and calculus and debris from everyday life becomes fixated on the tooth, the body can't get rid of it. And particularly if you can't clean it or you're not cleaning it, you're going to have a problem. Because now the body's going, I've got a foreign body getting stuck near my skin. What's it going to do? It launches the inflammatory reaction. So it starts dissolving the bone around the tooth with the intent of making that person lose the tooth or the implant out of their mouth. Because if the tooth or the implant leaves the mouth, all the crap stuck on it goes with it. So the body's still trying to reject the crap. And then we get what we call the most complex part, or the immune system, or the immune response. Talk about it as human variation. Some people have a mouthful of crap, the gums and bones, don't care. Some people have amazing oral hygiene, a little bit of plaque and calculus, massive response, and everything in between. And we know there's a series of factors that influence why somebody's immune response works the way it does, such as genetics, stress, smoking, diabetes, cardiovascular, immunotherapy, steroid therapy, systemic diseases, on and on and on. You've probably got a problem. We've got a study looking at the link between that and gum disease. So when we ask you those 101 questions, we're not quite as good as the Australian Taxation Office, but we're trying to understand why your body is reacting the way it is